Hi everyone, my name is Amy Cullen and I chose to do my topic on cystic fibrosis. Cystic fibrosis is a genetic disorder passed down from parent to child affecting the secretory glands. This disorder produces an excess amount of mucus which prohibits proper respiratory and pancreatic function. The thick layer of mucus that builds within the lungs, pancreas, bronchi, or intestines causes a much higher rate of infection, making it much more difficult to fight off. The disease is inherited by what is known as an autosomal recessive manner, and most patients who are diagnosed with CF are very young, usually around the age of 2. The mutated gene is found in the seventh pair of chromosomes called cystic fibrosis transmembrane regulator, also known as CFTR. Each patient has to contain at least one carrier of the mutated gene in order for the child to get the disease. That protein, CFTR, is responsible for regulation of fluids and salts going in and out of the body. Cystic fibrosis is caused by the mutation of this gene, where the protein is not properly functioning or not even created at all. This genetic disease is more commonly diagnosed in younger patients, such as newborns and infants. One of the most common symptoms with a child with CF is when the mother kisses the baby, she notices salty tasting skin. Other signs of newborns with CF are slower than normal growth rate, inability to gain weight, losing weight, coughing, as well as respiratory problems. Most of the respiratory, digestive, and reproductive problems occur later on in the child's life with CF. As the patient gets older, complications in the airways increase through the buildup of bacterial infections as well as mucus in the lungs. These infections do not respond to normal medications. For example, the bacteria called mucoid Pseudomonas is normally found in patients with CF. This buildup of mucus grows thicker, causing it to stick in the lungs, blocking the airways. With respiratory complications, they can also develop nasal polyps, which grow inside the nose, or frequent experiences of bronchitis, pneumonia, and sinusitis. Patients with CF can also have symptoms with their digestive system. The mucus buildup can occur in the duct of the pancreas, preventing enzymes to reach the intestines. This means that your intestines will be unable to absorb fats or proteins, which can cause consistent diarrhea and stomach pain. Children who typically have CF will have complications with their digestive system and the ability to grow because nutrients that are needed cannot pass through the blockage of mucus. Some problems that can arise from digestive symptoms are pancreatitis, rectal prolapse, liver disease, diabetes, as well as gallstones. The reproductive system can also be affected if someone has CF. A man with cystic fibrosis will be infertile because he was initially born without the organ known as vas deferens, which is a tube that transfers sperm from the testes to the penis. A woman with CF may also have infertility problems because of the buildup of mucus in front of the cervix, which initially blocks any passage of sperm. Although there is no cure for the disease yet, there are many forms of treatment that can help prevent and reduce the symptoms to help people manage a normal life. When both the mother and the father carry the CF gene, the probability of a child getting the disease is about a 25% chance, so 1 in every 4 babies. Children can also receive the CF gene, but only if they get one gene from either of their parents. They will not suffer the symptoms of the disease because it requires both genes from each parent. This occurs in about 50% of cases. The United States has one of the highest rates of cystic fibrosis diagnosis. The genetic carrier of the disease is more prevalent among Caucasian, Northern, Central European descendants, as well as Latinos and American Indians. Currently in the United States, there are about 30,000 people who are living with cystic fibrosis, and nearly 70,000 are diagnosed worldwide. Most patients are diagnosed by the age of 2, but sometimes they can go undiscovered until they are much older. The life expectancy for patients with CF is typically 30 to 40 years old, and this has increased significantly over the last few decades. About 30 years ago, medications and therapy, they were so limited that patients with CF weren't expected to survive past grade school. This has improved significantly. So researchers are doing whatever they can to work on advanced treatments and ability to increase patients' life expectancy as well as their ability to function normal and happy and healthy life. According to CFF's National Registry for patients with CF, more than half of the people right now diagnosed with cystic fibrosis are over the age of 18.